Lori, can you hear us?
You are online.
Okay.
It's recording. So you,
One more minute.
oh. Well, I can pause. We can just.
No, we're good.
Oh, okay.
We're good.
15 seconds.
15 seconds.
If anybody needs minutes or agendas out there, would you like an agenda? Here's the approved minutes from the last meeting.
Thank you.
Can I share? Or
Yes.
Okay, we'll start. I'm not going to gavel, so. I'd like to call to order this January 25th, 2024 meeting of the Healthcare Advisory Committee between the city and Peace Health. Kim, you want to do a roll call?
Sure. Amanda Robinson,
Present.
Lacey Simpson,
Present, sorry.
Scott Smith,
Present.
Dory Stevens,
Here.
Judy Zingy,
Here.
Clay King,
Here.
all present, Your Honor.
Perfect. Communications, item number 3, we do not have any that I am aware of. So that moves us into the 4th agenda item, which is persons to be heard. We have a couple folks in the room and some online. So we don't have a sign up list. We're pretty informal. So if someone would like to address the hack, please go ahead and step forward to the podium.
Do you want me to change the camera or do you want to?
Yeah, sure. Let's do it. Sorry, Kim.
It's okay.
You can come on up. And please state your name.
My name is Karen Afonso, and I'm currently the president of the Ketchikan Registered Nurses Union. And we are here listening and observing some of these meetings. So thank you for having us.
Absolutely. Thanks for coming. Would anybody else in the room like to address the Healthcare Advisory Committee? Or anyone online? Okay. So we will move on to agenda item number 5, which is approval of the October 23rd, 2023 Healthcare Advisory Committee meeting minutes. These were provided to the committee in advance. We have copies in the room. And again, we're pretty informal here. I'm not going to do a vote. So if are there any questions on the minutes or any errors, discrepancies that anybody would like to?
Looked accurate to me.
Okay.
So to approve.
Good. Second.
Second. Okay, we're okay.
It's all
Thanks,
right.
Judy. We so rarely do this. Okay, so Scott and Judy, are there any further discussion on the minutes? Okay, all in favor of approval, please say aye.
Aye.
Any opposed? Okay. Those are approved. Old business, we have none at this time, so that moves on to new business. Our first item, I would just like to welcome new/returning members of the Healthcare Advisory Committee. So Amanda Robinson is now the city's one of the 3 city appointees. Amanda is our acting public works director, so she both in terms of her professional role and then here on the Healthcare Advisory Committee is kind of filling in for what used to be Mark Hilson's seat, our previous public works director. Amanda has a lot of experience working with the hospital from a building and maintenance perspective, so she brings a lot to the table and her position, so thank you very much, Amanda. Also, Judy Zengi is our city council appointee and will be with us for the next year. Judy was on the first year of the Healthcare Advisory Committee and was fantastic. So I'm personally very excited to have her back. Thanks, Judy.
Glad to be back.
And everybody else is same old, same old.
Same old. I'm getting older.
Yes.
Well, I'm
Okay.
glad to be in that same old group, Lacey.
Yes, it's nice to have some consistency.
I need company.
Yeah. Our new business item B is the election of the chair and the vice chair. So in my review of the charter for the Healthcare Advisory Committee, I realized that the chair is supposed to alternate between a city and a Peace Health representative every year. And we overlooked that, and I've been the chair for the last 2 years. So that means a Peace Health representative from the HAC needs to come forward as the chair, and then just the opposite. So the vice chair would then be a city representative. So would anybody like to bring forward a nomination for a Peace Health representative for the chair?
So I think we've got between Scott and I, right?
Yep.
Scott, do you want me to take it, or are you desperate to do it?
I am not desperate to do it, Dory. But if you
Okay,
need me
I-
to, I'm happy to as well. Whatever you
All
think.
right. I'll take it this time, and then we can trade off.
Okay.
Beautiful.
That was easy.
That was very easy. Thank you, Dory. Is there any opposition to that from the HAC?
Don't raise your hands.
That'd be
Oh.
best.
Likewise, we need a vice chair for the city.
Well, I'm gonna nominate Lacey Simpson. She's done a great job over the years. No reason why it shouldn't continue.
So
Not
we'll
a
just
problem.
swap roles, Lacey.
Yeah, I know. That's exactly what's going to happen. So, okay, happy to do it. Not a problem. Dory and I work well together. So we will have Dory as the chair for the next year of the HAC, and I will serve as vice chair. Item number C is update on the same day clinic, which opened October 3rd. When we last gathered, we had a great little overview from Dory on how that had kicked off. So I think we're all interested to hear how it's continuing. So Dory, go ahead.
Sure. So we've got data now for 3 months, and Laura, you can. So this slide, nothing's really changed. Laureen is still with us. The hours of operation have not changed since our last meeting, and our appointment times have not changed. So this is all data you had seen before, and this plan seems to be working well. Volume-wise, in those 3 months, we've seen 327 patients. Waned a little bit in November, as you can see. Did a little bit more advertising, and that's picked up in December. You can go to the next slide, Lori. And this is just a graph on the type of patients that we are seeing, and it's pretty much the types of patients that we thought we would see. Some respiratory, a few injuries. So this is just some information that could be of interest, but they're seeing a variety of things, and Lorraine is very happy in her role. And the next slide gives us a little bit more information. Number of pediatric patients is about 22% of our patients. No-show rate. Of course, we'd always like to have a 0 no-show rate, but 3% isn't terrible at all. What's interesting, we started this, and one of the reasons the city had wanted us to start a same-day clinic was to support after hours and some weekends. And as you can see, our after hour numbers aren't really all that high, nor is our Saturday. Not real sure what the reason for that is, but we are keeping a few patients. Maybe that would have gone to the ER, or maybe just wouldn't have come in for care at all after hours or weekends, but small percentage. Next slide. And you saw this at the last meeting as well. Nothing's changed here. It just gives everybody an idea with a little bit more detail, the types of symptoms and illnesses that we see and treat in our same day clinic versus with our regular primary care physicians. So I won't go over each one in detail, but that's the list. That's pretty much it for the same day clinic. Does anybody have any questions on that or concerns, thoughts, advice?
I think that looks great, Dory. We did have someone pop their hand up in the audience, which I will allow. Hello, Sarah.
Okay, hi, Sarah Hines, and I actually work in the ER, so I just have some questions on that side of it. One, is the phone system up and working now? Because I myself tried to call a few weeks ago and couldn't ever get through, and was told by the staff up there that they just had a problem with the phones and they were working on it.
I'm not aware of any phone system issues, so I can't respond to that, but I will definitely dig into it.
Okay, and then my other question was, we are seeing a ton of these patients that are absolutely appropriate for same-day clinic in the ER still. So are we working on a system to kind of triage those patients to same day instead of having them come straight into the ER?
Well, there's EMTALA, there's a lot of EMTALA issues with that. We cannot encourage somebody to go to same day clinic or advertise go there instead of the emergency department. So anybody who shows up into the emergency department, we are obligated to do an MSC on them. At that point in time, after that, legally, you could refer them up to the same day clinic, but that's a patient's choice. And we're not allowed to have like a sign out in front that says, if you have this, go to the same day clinic, because there are some restrictions with that.
Okay, thank you.
You're welcome.
Thank you, Sarah.
I have a question.
Yeah.
In the advertising for the same day clinic, is this listed? The available services, is that listed in the advertisement so that people know that they can go for these, cuts and abrasions and things that they would normally go to the ER for?
Yes, to my knowledge, I haven't seen the actual advertisements. I don't think it's as detailed as this last slide. We kind of summarized it up a little bit more, but yes, it does describe the services.
Okay.
Dory, when this was opening, I recall there was a nice article in the paper. Would it be worth some sort of follow-up like that, either with the paper or the radio stations, to just talk a little bit more in detail about what the services are at the same day clinic? And just,
I think we just did a radio one not that
Okay.
long ago, because when we noticed those numbers going down in November, Kate, from Marcom, I'm sure all of you have met her, did another little blitz in December in a couple different fashions.
great.
Social media, I think it was in the paper. I believe there was a radio ad recently, and we'll keep that up, quarterly in some kind of marketing fashion. Now, some of this too, when it comes to patient decision making of where they're going to go, some of it does depend on their view and their insurance type. People who have high deductibles in the emergency room are going to be a little bit more cautious and know what their alternatives are. And then some payers don't have those co-pays. So from an out-of-pocket expense, it doesn't matter to the patient which one they go to. So unfortunately, that's kind of a little glitch too on any kind of urgent care, same day clinic.
Okay. So this has been kind of a standing agenda item that I would like to keep as the hack meets, so we can kind of track how it's doing. Dory, is it possible when we have this report again to see trends in the ER, like how the same day clinic is impacting ER visitation? in use?
Yeah, I mean, I can definitely get a report that compares numbers. One doesn't always
Right.
mean the other, and its seasonality. ER is going to go up even if same day goes up, and but yeah, I think we can figure out something. Just be mindful; it may not mean a whole lot.
Sure.
I know when I started up a same day clinic, urgent care, when I was in California, the whole intent of that was because our ER was so impacted and the volumes were so high. Let's start up this urgent care to see if we can bring the volumes down. And the volumes on both just went up. It's
Okay.
not always the same people using those services.
Sure. Well, I've heard good things so far out in the community about the same day clinic.
Good.
Oh, sorry, Karen, go ahead.
Dory, this is Karen Afonso. I'm one of your staff nurses in the emergency department right now, and I just wanted to maybe make a suggestion on some help to gather some of that information from the ER, as far as maybe look at our level 4 and 5 patients. That's our triaging system based on acuity and urgency to see a doctor. So
Right.
I believe our level 4 and 5s would be appropriate patients for the same day clinic. So maybe that can help you gain some information. And then just also as a nurse in the ER, a lot of our patients that are coming through the door didn't really know that same day services were available, and or their complaint would have been appropriate to go to the same day clinic. And I have seen some advertisements locally for it. I'm not on social media, so I don't know what might be out there on Facebook, but just as far as our weekly papers and such, and I know it's not super detailed as far as what they can see in that clinic, so maybe a little further education for the community members, because it is quite costly to go to the emergency room for
Yes, it
basic
is.
treatment, particularly because we're critical access. We do charge a lot more than hospitals down south, and the insurances have levels that they are willing to accept for, like, nationwide cost of what procedures should be, and ours is significantly higher because of that critical access. So it would benefit people to be able to go to a same day clinic for these.
Yeah, that was the whole idea of the same day clinic, was one, to get after hours, for the doctor's offices, and try to decrease everybody's healthcare costs by bringing people into the setting that is not the highest cost, but the right cost. I'm going to check with our EMTALA experts. I'm wondering if we can't put signs in the hospital, not around the ER, but in the hospital, kind of advertising the same day clinic. So I'll follow up on that to see how close we can get.
I appreciate that. Thank you.
So
Mhm.
Karen, can I ask a question?
Yes, sir.
Yeah. So a patient comes in and they're at level 4 or 5. Once they're in the emergency room or department, can you redirect them?
No, I cannot.
Okay.
That was
You have to do the MSC screening first.
Yeah, and the MSC screening really is the doctor seeing the patient.
Okay.
So once they've hit that level, for us anyway, in the ER, OB has different MSC guidelines than the ER does, but that would be can be considered an EMTALA violation. So usually, we continue bringing them in, and we just say there is, just for your knowledge, in the future, we do offer same day clinic services, and if that's, what you'd like to do, you can reach out to them as well. But we would never discourage somebody or send them elsewhere if they wanted to be seen there.
Sure. Okay. Thank you.
Once you hit that MSC screening, you're getting billed from the ER, and if it's a small issue, it only takes them a few minutes to just fix it versus stop what they're doing and send them upstairs. So, that's always a challenge. But let me check with RIS to see what kind of advertising we can do in the hospital that's not right around the ER that would discourage people from going in the ER, because that's where we would get into trouble. Great
Question?
idea. Thanks.
Question for you, Dory. Because the ED group is a contract group, when those bills go out, do they go through the same billing system as the other Peace Health
The
bills? I don't know.
ER physicians, the ER hospital bill, yes, the ER physician bill goes through their billing, but
Okay.
they follow our policies on billing and not sending to collections or how we would send to collections. They follow our same policy. And we put that into the contracts, gosh, 3 years ago, probably.
Okay. I was just thinking, and I know billing is, and just the production of bills is a big deal. But if there's any way to let people know about the same day clinic via their bills when they go out from the
I don't know.
ER.
I don't know. I
That
will
might be a
take
big
note on that.
ask. With
Yeah,
whoever
that's
does the
a big
billing,
one because
but-
we'd have to change, the bills are standard to all of Peace Health. But,
Right. Oh, yeah.
um,
So everyone can know that Ketchikan has a same day
yeah,
clinic.
everybody would know in 3 states.
Okay.
But all 3 states do have urgent care, so maybe we can generalize it. But I'll check it out. Doesn't hurt to
Okay.
ask.
Thank you, Dory.
Mm-hmm.
Are there any other questions or comments on same day clinic? Oh, yes, hello.
Hi, Dory, this is Becky. I'm one of your staff nurses in the emergency department. My question is, if a patient presents to the same day clinic and if they've been deemed their medical conditions too acute to treat there, and then they're sent down to the ER, do they receive 2 bills for that visit? So they get a same day bill and then an ER bill?
I can't say which one, so let me check on that for you, Becky. I'm going to doubt that they get 2 bills if they're immediately sent down. If they get any treatment up there and then sent down, if they've sent them to diagnostics, but I will check on that.
Okay, because I know what has happened, like they might run 1 or 2 lab tests and then say, well, you're gonna need further testing, and then they're sent down to our emergency department. So I just wanted to clarify that. Thank you.
Mm-hmm.
Marie raised her hand.
Oh, got some folks online. I see a hand raised. I'm not sure who that is. But go ahead.
Horton. I'm the foundation manager here in Ketchikan for the hospital. And I just wanted to answer an earlier question. So what you're seeing on the screen there is the back end of one of the same day flyers that lists all of the different services. And we have that in a PDF version if anyone would like it emailed to you.
That would be great, Marie, if you could send that to Dory, and then the HAC members can have it. That would be wonderful.
Yep, wonderful.
Any other questions or comments on same day clinic? Yes, Becky.
I'm sorry, I thought of something after that sat down. So with, as we all know, summer is approaching, and as we all know, our population is gonna triple, quadruple. Are there plans to upstaff with another provider in the same day clinic to help offload the stress in the emergency department?
Well, the numbers in the clinic, even during the summer, we wouldn't have rationale to do that until there was more numbers. They have had open spots, so we'd have to see what that usage is first.
Are there plans for, or what are our plans for the summer to accommodate the surge in population in regards to make this not necessarily same day clinic, but with the emergency department and inpatient care?
I don't think I understand your question. Same day clinic too, keep in mind the hours start at noon. The ships start leaving about 5-ish, and then the clinic's open until 7. So only partial hours would the cruise ships be able to take advantage of that. And we are going to start marketing to the cruise ships. I think we did it initially. But what we found a little bit when we first opened is that some of the people from the cruise lines that were using the service, and they probably will use it more because it really wasn't open for very long during cruise season. Cruise season, I think, closed within a week or 2. But some of the employees on the cruise ship were using the same day clinic. get their medications refilled and, some of these kinds of things that may pop up.
Yeah, because historically in the summer, we do see a lot of passengers as well that need medication refills or have simple injuries. And as you know, unfortunately, I've been in the community for long enough to know that over the years, I've seen the acuity increase dramatically with a lot of these cruise ship passengers. So I was just curious what we are going to do to help accommodate that acuity. This is not necessarily same day related, but for the emergency department and the hospital as a whole, are we working on increasing like staffing levels for this increased acuity to help decrease ER porting? Or like, do we have a surge planned for this summer?
Kim is working on that, so I would encourage you to have conversations with her. So I don't miss
Sorry.
your boss, Kim.
Okay, I will. Thank you.
Yep, you're welcome.
All right, any other questions, comments for same day clinic? Okay. Moving on to item D, which is an update on the ED remodel in its various phases. So again, this is something that Dory, I believe, will address.
Sure. Okay. So next slide, Lori. So we've talked about this project in phases. So phase 1 is getting the new CT scanner up and running in new space. So that new space, as we are doing the construction, won't impact the emergency department. So this will be the easy phase. Capital's been approved. We've got a conceptual design. We have finalized the equipment quote and purchase order, and we've got detailed designs, or the detailed designs are in progress with construction, and we've got a HRSA grant application in progress that will help financially support this project. So as soon as we get phase 1 done, then we phase 2 and phase 3 are kind of simultaneous. We're not waiting for one to complete to continue working on phase 2 and phase 3. So any questions about the phase 1?
So question maybe for Amanda and Dory, I don't know the level of impact in terms of the building for this first phase. Has there been conversation between Public Works and hospital staff?
Typically on our side, if it doesn't impact the shell of the building, then we stay out of
Okay.
it. So if you change your space inside as much as you would like, as long as it's meeting code and the building department is informed of any changes and you get your proper permits. If it does impact the exterior of the building, then we get involved in typically that's our project, and funded by the city. So we would run that.
Great.
And we're not impacting the outside. It's all internal, correct, Scott?
Yeah, that's correct. Yep.
Thank you.
Yep, it's all the shell space from the old operating room shell space.
Great. Any questions on that first phase? I guess, Dory, what's the timeline? Wait, and it's up there. Never mind. Hello. So, like spring. Is that when this would be? Is the blue for this project? Or what's the yellow?
The yellow, I'm sorry if I'm getting my face way too close to that camera because the print is small on my end.
So in service in about a year.
Yes, that's about
Okay.
what it would take.
Okay,
Thank you.
got it. Thank you.
Yeah, because we got to even, once the equipment is paid for, it takes a while for it to get here.
I bet it does. Yeah. Okay.
All right,
Karen?
next slide, Lori.
Oh,
Oh, I'm
sorry.
sorry. Any other questions? Sorry.
Sorry, Karen has a question.
Dory, this is Karen. I just wanted to know if there had been any kind of internal hospital committee or any kind of feedback from any of the emergency room physicians or nurses, staff in the conceptual design of this new ED.
Yes, I will say had Eric Lake, who's the project manager, has had some difficulty getting people engaged in that process. The ER doctors and Kim have been involved, and Eric's got something on the books, I think in about 2 weeks, and to look at this second set of designs. And the request that from him is to have me, at least 2 RNs from the staff, and ER, Dr. Epler, and Kim to be looking at this second set of designs to see what needs to be changed or moved around. And then, we're trying to get it at least to a point where we can get a cost estimate on the project, because we haven't even gotten that far to be able to get a cost estimate.
I know there was a kind of a running document that was in the ER for a while. I don't know how many people knew it was there, but there were people making notes on that, and I'm pretty sure Eric Blake got that.
Yes, he did.
And there was also a change too. For quite a while, we were considering whether or not it made sense to keep to keep our old CT scanner where it was and have 2, just so that we always had a backup scanner. And so once we decided that we really couldn't make that work, then that, of course, for phase 3 made some additional space available in the ER. So it kind of got shuffled and re-looked at in more detail. So my guess is, or I'm sure Eric's considering that, and we'll make sure that you guys all have a chance to take a look at it. And,
that's one of the intents of the next meeting, because we'll gain some space now that we've made a decision to not keep the old machine. So that'll free up some more space in that area.
So communication then from admin will go to our boss and then hopefully go down to us about participating in that.
Yeah, Dory, I'll reach out to Eric and see what his plan is, and then I'll make sure to come back and make sure Kim and you all get some feedback as to what that looks like.
Okay.
So there's a little more concrete plan, but if we need your input. We need your input.
Yeah, I know Eric was on it. We just met last week about this next go around, and I gave him my request of people we needed to be there.
All right. So Dory, would you like to go on to the second and third phases?
Sure, thank you.
Thank you.
So, part of this project is lab, because phase 2 is lab. We can't do much with the ER to give them more space without moving the lab. So the lab conceptual design has been completed. The second round of the conceptual design in the ED is in progress, and engineering needs to review, as I mentioned earlier, once we get this second round done, to give us some cost estimations, and then go into the capital approval process. And of course, we were going to be given a budget as to how much we can spend on this project. And like any house renovation, you get a budget, and then you have your wish list. And then when the engineers and the architects come into play, they have to match up what your wish list is to your budget constraints, and then you're making trade-offs. So this project will be no different.
And partially because of that, this probably can't answer it, but what's sort of the tentative timeline for these phases?
Oh, well, CAT scan's got to get done first. So,
Right.
I mean, if you look at this major type of construction, that needs to be done. And that when the actual, while this, you know, a lot of this kind of work can be done simultaneously, once you get to the construction, it's CAT scan first, lab second, and then ER. You know, I'd hate to take a guess, but just knowing what construction and projects are like in town and supply chain and construction and architects, it's going to be several years before we're done.
Yeah, the toughest part of all of this is the phasing and trying to figure out how to make that work and still have a manageable operating emergency department, and or lab or imaging. It's going to be painful because we're going to have to probably get by with less space than we have now at some point for extended periods while we try to, you know, get a new space. Anyway, I think that it's going to be important that our ER staff have input on that as well, but it's 3 to 5 years, I think, at least.
Dory, will these projects be bid? And are you hoping to have local contractors do the work, or are you going to bring people up from
Our
Seattle?
goal is to always to try to work with local first. And then the two things that we will be considering with trying to work with local is one, cost. If local is going to cost us, you know, more than quite a bit more than what local is, we're going to have to go with an outside vendor. And we've got to find somebody local that is familiar with healthcare building. And, you know, that could be a challenge with some of the other projects that are going on through Southeast Alaska. So our first goal is always to try to use local.
Are there any other questions or comments on the subsequent phases of the ED remodel? Okay. All right. So
All right.
agenda, go ahead,
Next
Doris.
slide. Yeah, I put on an extra slide. Just wanted to talk a little bit about workforce
Oh, okay.
work that we've been doing over, gosh, the last couple years, and it's been pretty exciting to start to see some success and results from that. You know, when I first got here was during COVID, so there was definitely a big slowdown with the nursing school. So we were not seeing new grads for a couple of years really come out of the program. And this last year, we've been pretty successful. So you with our new grads program, as well as with some hiring. So over the last 8 months, our RN vacancy rate has decreased by 6 points, which is pretty big when you're looking at vacancy rates. And we've had almost double our number of hires from 2021 to 2023. So that's been positive. We are investing in our new grad program, where in the past I wasn't a policy or rule per se, but practice, most of the new grads were going into the med surg areas. But this last year, we took a even larger investment into our new grads and have been orienting and training them into our specialty areas, and they seem to be working pretty well in most areas. So that's been pretty exciting to see new grads in the specialty areas that they wanted to go into. Lots of recruitment efforts. We have been transitioning some of our travelers into regular hires. Really exciting news. I just found this out last week. We've got 3 regular hires coming into our long-term care unit, and that's a department that has been heavily dependent on travelers for a number of years and for a number of reasons. So we're really excited to have those 3 experienced nurses come in, and they're all new hires. We do have some community scholarships for various disciplines that we have granted, and that supports them while they're going through and finishing up their university programs. We've got a physical therapist finishing up their last year. I think that's on one of our community scholarships. Scott's been doing a good job working with the University of Alaska. We had some glitches just recently that Scott had uncovered with getting in folks from their program into our clinical program, which we do offer, but it slowed down for from the University of Alaska, and that is a really good pipeline. And to have people that do their clinical on site tend to try to get jobs at the place that they do their clinicals at. We've got a targeted system approach to recruitment with focus directly on Ketchikan from our system recruitment team, and they've expanded their footprint for recruitment into Idaho, Montana, California, Nevada, Illinois, and Maryland. I've gotten information from other CEOs up north that when they started recruiting into Idaho and Montana, they've been pretty successful there. You know, it's got actually the weather's snowier and colder there. The salaries for healthcare folks in these two states is much lower than it is in Alaska. So that's been a successful recruiting area. So we've expanded our footprint out. And then we have recently signed contract with an international recruitment team that brings people in from other countries. And that is going to start netting us some applicants probably in the next 6 months or so. And then just one of our retention efforts is to try to continuously give our caregivers those growth opportunities that they're looking for, whether it's specialty training in nursing, specialty training in diagnostics, et cetera. So just a brief update on some of our successes. I just saw a summary a couple of days ago that we've got 9 new folks, about 9 people coming off orientation between February and April. That will give us some new people that can help with permanent staffing. So we're excited about that. And that's all I've got.
Thanks, Dory. Sarah, you've got a question.
I do have a question. This is Sarah. Is there a plan in place to help with these recruited employees with affordable housing? Because I know a lot of people would like to come up here and are unable to find affordable housing. And so I know that's an issue for everyone, but is there anything in place where the hospital is thinking about, building some housing or finding more permanent housing for people that want to come up here and just need housing either in the interim or longer term?
Well, we do work with folks before they get here and hook them up with experts in the community to help find housing. We don't subsidize housing for people that are signing on and coming in as new. There's different relocation packages that we have available, and there is some support for a couple months to help them with finding a place to live. We have talked about building apartments to help with the temporary solutions, but we have to be really careful because if we provide housing support for new people coming in, we have to look at equity about people who are already living here and are already in housing. So that's always a tough balance. Building right now for us is prohibitive. One, we've got the ER project that we're funding. So funding an apartment building, go live and build would be a financial hardship. But we do have some apartments that we own and some that we rent. So so we use that typically just for temporary people that are coming over here to work, like our cardiologists or cardiology teams that are coming out here for a week to provide care. So it's used in a variety of ways, the limited housing that we do have in our that either we're contracted rentals or a couple of apartments that we do own.
Thank you.
But it is a challenge for sure.
Karen, you have a question.
Dory, this is Karen. I have a question in regards to the retention and growth opportunities for our new nurses. As a seasoned nurse, I just am looking at what is the retention for those of us that are seasoned and experienced and that will be managing this training of these new grads into these specialty areas. Knowing that
Well, the specialty training is available to everybody, not just the new grads.
Oh, okay, so aside from the new grads, is there any growth or retention opportunities for those that are facilitating that training?
So those that are facilitating the training, I think Christy's got some mentoring programs and preceptorship programs to help with those that are doing the training. I guess if that's what you're asking.
Not specifically, Dory. With all of the new grads that we are getting from the local college and that are locally trained, it's unfortunate, but we just don't have the volume here of cases to really get new grads up and running in like a 3-month period. It just takes us longer to do. So that
Yeah, that's why we send them to Bellingham.
right. I know for the ER staff, we've seen them go for 2 weeks. And then for the OB staff, there were 2 new grads to OB and they went for a total of 3 months for training there.
Uh-huh.
Which I know was kind of hard for them because they also had residences here. So they had to keep up with both to facilitate that training.
Yeah, so we try to get them to places where they'll get that concentrated learning opportunity.
Thank you.
Mm-hmm.
Any
All right.
questions for Dory on the workforce update?
I have just one suggestion that was brought to me. I know we're not supposed to really do employee relations, but I wanted to bring it up. Recently, I was talking with someone who is an employee, and we were talking about new mothers returning to work after having a baby and breastfeeding and pumping. And they expressed to me that they had a 15-minute break for which they had to go to another building, set up, pump, clean up, and get back. And it was impossible. So I think it just would be advisable to have some kind of accommodation for a new mother to be able to either have an office that's nearby that they can utilize, or give them a little bit more time to be able to pump and clean up and get back to work.
I will look into that.
Someone who had a really hard time with that when I had my daughter, 15 minutes wouldn't have, it was just not even. And I was someone who needed to pump in order to keep the supply up to feed my daughter. So I think.
All right.
just
Well,
a
I will
suggestion.
follow up on that. Mhm.
Okay.
Thank you.
Other questions or comments? Thank you, Dory, for that update. All of you.
You're welcome.
So our final new business item that was mentioned at the last meeting was a discussion of the report card delivery to the hack.
Yes.
So the hack decided at some point within the last year that we would like to see an update of that report card semi-annually. So we do it in April and then October. I think according to the charter, it's only required to be, as the name suggests, an annual report card. So just wanted to have a discussion with everybody to see if we still want to keep that twice a year cadence, or do, maybe the big annual report and then something smaller in the half year or half term mark. So any thoughts that anybody has?
I think maybe a big annual report and then just a progress update at the 6-month mark that isn't as in-depth.
Well, the question I would ask on that, I mean, all the numbers are progress numbers. So it would just be the same report. But do you want me to maybe take a stab at the April report, having less elements, but those elements that would make more sense to report out on a shorter time frame, and then present that to the group?
Yeah, we could certainly try that. I don't know if the group unfortunately, we don't have the report card sitting in front of us, but I mean, there's a lot of different elements to it. But are there particular items that committee members would like to see at that sort of half year April mark? I mean, what are the things, and maybe Dory, this is an offline conversation you and I can have, like, what are the things that, we should be maybe getting an update on? So if they are going astray, we can provide some impact or some feedback to impact those numbers kind of mid-year before they.
Yeah, the report card is patient experience data. There's some quality metrics in there. And then the financial ones, we only report out on that part of the report card at fiscal year end in October anyway. So I don't know, let's take a look at it, Lacey, and see if there is maybe a way to abbreviate it. And if there is, if you guys from the council see the report, if there's, 1 or 2 items on there that you're really interested in all the time, then let Lacey or I know too. If there's just something on there that you really enjoy seeing and is important to you.
Isn't it really driven by the city?
The report card?
Well, what specifically you want on it, because a lot of this we get at our board meetings.
Okay.
The financial and so it would seem this is more city driven of what you're hearing from within, or people contacting you and saying, we'd like to know more about this.
It is partially, so you're correct. Like, so when the hack was formed, the contents of the report card were not spelled out. They're just like a couple items that needed to be addressed. So the hack at that time determined what metrics, what things we wanted to see and have in that annual report card. And yes, you're correct that some of what drives that is feedback that city council members and staff receive from the public. So it's definitely a living document. It can always change, but we've kind of locked ourselves into a format that seems to be working well and provide the information that we want. So and totally understand that the community health board receives different information because you have a different function.
Yeah.
So yeah, so I guess if there are items, if the committee members want to review the report card and make note of anything they would like to see in April versus just the one time annually, let me know or let Dory know, and then Dory and I can have a conversation on what might be appropriate for an abbreviated April report card.
And one thing to look at, and I know it takes a lot of time to put that report together, Dory, but one idea that you guys might kick around is just whether or not that second report, whenever that is maybe just variances. If there's significant variances or things that we're struggling with that or we're putting a lot of effort in to try to resolve at any given time, maybe that's what that looks like, and we can assume the rest of them are kind of on track. So pulling some data before we put it into a formal report and just looking to see if we have any significant variances that would be of interest to the committee.
Yeah, and we would know if we had significant variances, to Clay's point, based on the frequent reporting we do to the board and our quality committee and our quality committee of the board, et cetera. So, we've got a keen eye on any variances that may be happening on a frequent basis in lots of different areas.
Okay, thank you, Scott. Okay. Any other comments or questions on frequency of the report card? Okay. So agenda item 8 is future agenda items. So again, I would like to, if it's not a huge imposition, for Peace Health staff to continue having the same day clinic report, see how that's doing, and then
Yep, no
update
problem.
on the ED remodel, even though I know that's a big, long, slow, scary process, but it's a big one. And again, is a term of the lease, so I want to make sure that we're kind of kept informed and keeping an eye on it. But are there other items that for the next meeting? Judy?
I'd like to have some kind of review, a simple review of what happens when someone's brought in for a Title 47. I've had 4 or
Simple,
5
Judy?
calls. Yeah, a simple review. I did get the policy. Thank you for that. I read that. But I have had people call me and they don't know what to expect. They're not sure if this is, if what they're receiving is the way it should be. I'd like to at least, I don't know if there's a way we can simplify that. So they just know what to expect. They're already stressed out. They're going in there. They want to know what's next. So if we could, if somebody could provide me that information, that would be great.
Yeah.
I will work with the team to see what I can come up with.
Thank you. And also, that website where people are entering complaints, concerns, or compliments.
Yeah,
Did it move again?
I don't think so, but I don't look at websites.
Okay, so who would that I could call, because there
Kate.
are people trying
Kate
to
Govar should be able to
Okay.
walk you through it. Do you know how to get a hold of her, Judy? You want me to have her call you?
have her call me would be great.
I can do that. She's on vacation this week. That I do
Okay.
know. All right, I'm on it.
Thank you so much.
That reminds me, if it has moved, I think we have links on
Yeah,
our
then-
website. So
Yeah, we'll bring it to the
establish
entire
those
group.
links.
Well, I'm thinking it has, because people have been calling me going, I'm going to where you tell me, and that they get an error message. So it might
Okay.
just be something with the system that's not working or something.
Okay.
I'll check it out.
I think it's important every time people call with a complaint that we direct them there. So
Yes.
Mhm.
folks start getting used to using that as opposed to council people or HAC members.
Agreed. And
Hey,
then-
Lacey, why don't we put it on the agenda for the next meeting? So we can either report out, yeah, it's the same, we had a glitch, or it got changed when we were doing website updates.
Will do.
Okay.
Chair.
Oh, yeah, that's me now.
I was wondering if that was.
I guess I should have passed the baton for this meeting, but it's okay. Because
Yeah.
It's awkward with Dory not being here.
I'll take it.
Perfect. Any other future agenda items?
Well, I have a question. We have, I think 4 nurses here, and there are questions asked, and were all your questions answered, or do you have anything else?
I have lots of things, I've never been in one of these meetings before, and I'm just a little, I'm not sure, how to ask as far as being an employee of Peace Health, but also just being somebody that lives in town, that's also dependent on the services that Peace Health provides. Just full disclosure, I feel a little uncomfortable because I'm dependent not only for my healthcare, but, my job, so I'm not sure exactly what to ask or what I can't ask.
I don't know of any restriction.
There's no restriction in terms of what. Sure, no, absolutely. I'll just offer, just so that folks in the room are aware, kind of the function of the Healthcare Advisory Committee. So this committee was set up to monitor the terms of the lease agreement between Peace Health and the city being the building owner and Peace Health being the operator and occupant. And while we have this longstanding history, and this group I think has been really successful in again, monitoring those terms of the lease. The terms of the lease are pretty specific in terms of what the city and this group are going to involve themselves in with respect to Peace Health's operations. So while we're happy to receive, comments about operations or personnel issues, we don't involve ourselves in those matters unless they rise to something that is sort of outlined in the lease. So day-to-day operations, this group in the city is not going to tell Peace Health specifically how to basically do its job. But, for example, when we talk about operations, we're talking a lot about same-day clinic and ED. That's because those were spelled out in the lease. Those were provisions of the lease that Peace Health needed to fulfill as part of its obligation. So that's kind of one of those areas where we step over simply because it was spelled out. But generally, like if there were concerns about what's going on in long-term care and how that's being ran, we wouldn't necessarily involve ourselves in that. So
Are the details of this lease agreement public to the community?
absolutely, yep.
Where can we access that?
So the lease agreement, if you go to the city's website, and I apologize because our website is not the most user-friendly. Someday we will have a sparkly website that's easier to use. But if you go to the main page of the city of Ketchikan, up at the top where it says general government, this drop-down menu will populate that lists all of the departments. And under the mayor and council's department, there is, I think it says hospital lease or Peace Health lease, something to that effect. And if you go there, an entire page comes up that has information about the Healthcare Advisory Committee meetings. So our agendas, our minutes, any items pertaining to our meetings, who we are and our contact information. And then the lease itself between Peace Health and the hospital is on there as well.
Okay, so if I'm understanding correctly, like this meeting is to make sure that what is in that lease is being followed through by Peace Health.
Yes.
Okay.
Yep.
Thank you.
Yep, you are welcome.
We've heard all these terms and we've talked about it, but just kind of getting the nitty-gritty details of that will be really helpful.
Yep. If you have questions, once you look at it, because it's a legal document, it's not
Right.
fun to read. So if you have questions, just let me or Dory know. We can try to
I
help.
appreciate that.
Yep.
Thank you.
And I don't know if this is something that it's not gonna be fixed here, but what keeps me up at night as an ER nurse is the summer. I'm really nervous for the summer.
Mhm.
There are several days with 18,000 just cruise ship passengers. That doesn't include the crew on the ship. It doesn't include the seasonal workers. And I will definitely reach out to my manager, but I've never seen a surge plan for us in the ER. And looking at, how we function, we've had fairly busy days even now in the winter where we're having a hard time working with the acuities that we're seeing. And so, and in particular, those double-decker buses scare the living Jesus.
My goodness.
Because if
Mass casualty week.
Yeah, because if those go in the ditch, even if it's a slow, simple accident, you're looking at 40 people.
Right.
And we have 9 beds and 4 nurses, so it keeps me up as night, not only as an employee, but also as a community member with family here, is, if they're having a mass casualty and my kid has appendicitis, how can we, serve both needs? And
Becky, there is a surge plan policy. You might want to start there.
I will definitely do that because, I will, thank you.
That I do know exists, and then hook up with Kim.
Well,
And I know Kim is new, so she may want to, and we just updated it a year ago, but since she's new, she may want to add her experience and expertise. But I would start with the policy and with Kim would be my recommendation.
okay, thank you.
You're
I'll
welcome.
also just say it's not totally off topic, but the city and the borough are currently going through kind of some rethinking of our emergency operations plan. So things like this, I think, are good to keep in mind and incorporate into that. Also, I last heard, and this is like no consolation, but since we're just on the topic, I don't know where this is at, but I had heard that Ward Cove, as a cruise facility, was trying to set up its own same-day clinic. And I don't know where that's at, because that would certainly take some of the strain off of the hospital as well.
Do you mean
I
like-
heard, there's a doctor's office out there in
Like-
that area.
Yeah, that's
Dr.
No, so
Yes.
there's that, but I heard that actually one of the clinics in town was going to set up like a satellite facility
Oh.
on the
Oh,
cruise
interesting.
facility. So I can look in and see if that was
Yeah, I
just a
hadn't
wild
known that.
rumor or if that's actually going to happen, because that
Well, I
would
know
help
Seek has talked
alleviate-
about doing a same day as well, but I think he's that they've been having trouble with trying to operationalize that with staffing and people. So I know that was talk last year of them doing some kind of same day clinic as well.
Just in talking about cruise ships, I also heard a rumor that there's gonna be cruise ships going over to Prince of Wales this year as well.
So-
Is that true?
So not this year. So Klawock is in the process. They have a partnership with Huna Totem, so a native corporation, to build a small cruise facility in Klawock, so on the opposite side of POW. I think their goal initially is to service some of like the smaller expedition ships, so a few hundred people. They're not at a point where they could accommodate
Okay.
multiple 4,000 person vessels. So, but I mean, it's a good point because it could increase our medevacs, you know, things like that. So, yep.
So
Mhm.
I appreciate
but
that.
it's not happening. I think they're still in like a preliminary design phase. So they, as far as I'm aware, they're not like opening and operating this year.
Okay.
Yeah, no, they're minimally a year out, possibly two.
Yeah.
Okay, thank you. That's a relief to hear.
These cruise ships keep us up at night.
Yes, us as well. So, yep.
Very patients on these cruise ships, much sicker. I mean, I've been here since 2009, and I feel like they've gotten a lot sicker over the years and really require a lot of resources. And the stuff they're able to do on these ships in their clinics is really, it's pretty phenomenal. But which is great, but it does then really give us very critically ill patients
Right.
to manage until we can send them forward or manage them.
Thank you. Other questions or comments? And thank you, Clay, for asking our nurses. Any other questions, comments? Future agenda items? Anything else board would like to say?
Nothing.
Well, I move we adjourn.
All right. Thanks, Lacey.
Thank you all.
Bye.
Thanks, Dory.
Yep. See you soon.